Well, although COVID cases are trending down, there are still questions on how to live with it, especially as these new variants continue to emerge one after the other. Joining us now is Dr. Laleh Gharahbaghian, Medical Director of Adult Emergency Medicine at Stanford Hospital. Thanks so much for joining us, Doctor.
Thanks for having me.
Well, the FDA is considering a plan to offer a single dose of the COVID vaccine each year, similar to like the flu shots. Would those vaccines target any specific variants circulating at a time? Do you think that annual shots are really the best strategy going forward if we keep hearing about one new variant after the other?
It's a good question, and I don't expect that the institutions and organizations who are in control of these vaccines will do anything different like they do with the flu shot, where they see what variants are out there, what strains are out there, and then adjust every year. And what we know is that they do keep an eye on the variants that happen globally. So we know what's coming our way. A single shot will hopefully increase the number of people getting it, and know that that is their hope. And then it would protect more people. But what we also know is that there are several peaks that we see during COVID each year, the highest being in the winter time. So it would make sense, but I know that conversations are continuing on. One thing to keep in mind is that this does not involve patients who are at high risk. Those patients may still get more than one shot per year.
So is the goal, though, to go in, like, say, all right, every year you go in, you get your physical, you get your flu shot, and then you get your COVID shot? Is there a goal one day to have that all be kind of just one shot that you get, the flu and COVID?
I don't know if it'll be one shot. That would be very nice, but it likely will be separate shots, and it likely will be at the same time period as the flu, given that the winter time is where we see the highest peak.
I know a lot of folks are still going out there and getting their boosters. What have we learned about the effectiveness of the bivalent boosters against this newest COVID subvariant XBB.1.5, which is a very complicated name to say?
Well, what we do know is, thankfully, the vaccines has maintained a pretty high effectiveness against every single one of these variants. The current variant shows that the vaccine is effective at preventing infection itself about 50%, which is great. And that's largely amongst the young adults aged 18 to 49, with an effectiveness of about 40% for those over 65 years old. And so although not perfect, it is still higher than what we see with flu vaccines, which still we know is highly effective. It still is highly effective, over 98% at preventing death, hospitalization, and serious disease.
That's the most important. With all the recent variants, including this recent one, XBB.1.5, what about these rapid tests that you can get at the drugstore? Are they still effective?
Great question, because we all rely on them. So in order to get emergency use authorization, the test has to be at least 80% accurate. What we see with these new variants is that it depends on the timing that you test and also how you test. It's still, by the studies, show that it's between 75 to 85% accurate if used correctly. Now, the timing of it matters, because what these tests detect is the amount of virus, which is different than a PCR test, which does not require a high viral load. These rapid tests require you to have a high viral load, which means that if you've been exposed but not yet symptomatic, or if you just have the first day of mild symptoms, it might test negative. That's where repeat testing, once your symptoms develop more, will increase its accuracy, and you'll more likely have a positive test. Now, it also matters that you do it right, which means putting the swab way back there until it gets a little uncomfortable for 5 to 10 seconds in each nostril, and in doing what the instructions say for each of your rapid tests, reading those instructions, even though we think we know, there's maybe little nuances there in order to get an accurate result.
All right, some great advice. Dr. Gharahbaghian, thank you so much for joining us.
Thank you for having me.